Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. The bones of the foot provide mechanical support for the soft tissues, helping the foot withstand the weight of the body whilst standing and in motion. They can be divided into three groups. Tarsals, a set of 7 irregularly shaped bones. They are situated proximally in the foot in the ankle area. Metatarsals, connect the phalanges to the tarsals. There are 5 in number, 1 for each digit. Phalanges, the bones of the toes. Each toe has 3 phalanges, proximal, intermediate, and distal, except the big toe, which only has 2 phalanges. The foot can also be divided up into 3 regions. I. Hindfoot, talus and calcaneus, E. Midfoot, navicular, cuboid, and cuneiforms, and E. Forefoot, metatarsals and phalanges. In this video, we shall look at the anatomy of the bones of the foot, their bony landmarks, articulations, and clinical correlations. Tarsals. The tarsal bones of the foot are organized into 3 rows: proximal, intermediate, and distal. Proximal group. The proximal tarsal bones are the talus and the calcaneus. These comprise the hindfoot, forming the bony framework around the proximal ankle and heel. Talus. The talus is the most superior of the tarsal bones. It transmits the weight of the entire body to the foot. It has 3 articulations. Superiorly, ankle joint, between the talus and the bones of the leg, the tibia and fibula. Inferiorly, subtalar joint, between the talus and calcaneus. Anteriorly, talonavicular joint, between the talus and the navicular. The main function of the talus is to transmit forces from the tibia to the heel bone, known as the calcaneus. It is wider anteriorly compared to posteriorly, which provides additional stability to the ankle. Whilst numerous ligaments attach to the talus, no muscles originate from or insert onto it. This means there is a high risk of avascular necrosis as the vascular supply is dependent on fascial structures. Calcaneus. The calcaneus is the largest tarsal bone and lies underneath the talus where it constitutes the heel. It has 2 articulations. Superiorly, subtalar talocalcaneal joint, between the calcaneus and the talus. Anteriorly, calcaneocuboid joint, between the calcaneus and the cuboid. It protrudes posteriorly and takes the weight of the body as the heel hits the ground when walking. The posterior aspect of the calcaneus is marked by calcaneal tuberosity, to which the Achilles tendon attaches. Intermediate group. The intermediate row of tarsal bones contains 1 bone, the navicular, given its name because it is shaped like a boat. Positioned medially, it articulates with the talus posteriorly, all 3 cuneiform bones anteriorly, and the cuboid bone laterally. On the plantar surface of the navicular, there is a tuberosity for the attachment of part of the tibialis posterior tendon. Distal group. In the distal row, there are 4 tarsal bones, the cuboid and the 3 cuneiforms. These bones articulate with the metatarsals of the foot. The cuboid is furthest lateral, lying anterior to the calcaneus and behind the 4th and 5th metatarsals. As its name suggests, it is cuboidal in shape. The inferior plantar surface of the cuboid is marked by a groove for the tendon of fibularis longus. The 3 cuneiforms, lateral, intermediate or middle, and medial or wedge-shaped bones. They articulate with the navicular posteriorly, and the metatarsals anteriorly. The shape of the bones helps form a transverse arch across the foot. They are also the attachment point for several muscles. Medial cuneiform, tibialis anterior, part of tibialis posterior, and fibularis longus. Lateral cuneiform, flexor hallucis brevis. Clinical relevance. Fractures of the talus and calcaneus. The talus and the calcaneus are primarily involved in transmitting forces from the body to the ground and vice versa. This means they are frequently fractures in high-energy trauma. Talus. Talar fractures most commonly occur in the neck region, 50%, but can also occur in the body or lateral process. Fractures of the talar head are the least common. Talar neck fractures are typically high-energy injuries where the foot is forcibly dorsiflexed and the neck of the talus is pushed against the tibia. In this type of fracture, the blood supply to the talus may be disturbed, leading to avascular necrosis of the bone. Fractures of the talar body usually occur from jumping from a height. Calcaneus. The calcaneus is often fractured as a result of axial loading, typically from a fall from a height. These patients should be assessed for associated injuries such as fractures of the lumbar spine or lower limb. The bone can break into several pieces, comminuted fracture. On X-ray, the calcaneus will appear shorter and wider. Even after treatment, a calcaneal fracture can cause further problems. The subtalar joint is usually disrupted, causing the joint to become arthritic. The patient can experience pain upon inversion and eversion, which can make walking on uneven ground particularly painful. The calcaneocuboid joint can also be affected. Metatarsals. The metatarsals are located in the forefoot, between the tarsals and phalanges. They are numbered IV, medial to lateral. Each metatarsal has a similar structure. They are convex dorsally and consist of a head, neck, shaft, and base distal to proximal. They have 3 or 4 articulations. Proximally, tarsometatarsal joints, between the metatarsal bases and the tarsal bones. Laterally, intermetatarsal joints between the metatarsal and the adjacent metatarsals. Distally, metatarsophalangeal joint, between the metatarsal head and the proximal phalanx. Clinical relevance. Fractures of the metatarsal bones. Metatarsal fractures can occur by 3 main mechanisms. The most common method of fracture is a direct blow to the foot, usually from a heavy object dropping onto the foot. Another type of metatarsal injury is a stress fracture, an incomplete fracture caused by repeated stress to the bone. It is common in athletes and occurs most frequently at the necks of the 2nd and 3rd metatarsals and the proximal 5th metatarsal. The metatarsals can also be fractured by excessive inversion of the foot. If the foot is violently inverted, the fibularis brevis muscle can avulse, tear off, the base of the 5th metatarsal. Phalanges. The phalanges are the bones of the toes. The 2nd to 5th toes all have proximal, middle, and distal phalanges. The great toe has only 2, proximal and distal phalanges. They are similar in structure to the metatarsals. Each phalanx consists of a base, shaft, and head. Now let's have a quiz. 1. How many tarsal bones are present in the foot? 3, 5, 7, 9. The correct answer is 7. 2. Regarding the talus, which of the following statements is true? The talar head is the most common site of fracture. Neck fractures usually occur via jumping from a height. It articulates anteriorly at the talonavicular joint. Low risk of avascular necrosis. The correct answer is, it articulates anteriorly at the talonavicular joint. Thanks for watching. Like and subscribe to Anatomy Movement channel for more.